Hello and welcome to another Conversations with Dr. Westman. Today we're going to be chatting about medications while on a keto diet. Before we carry on, I also want to mention that we've got a bonus for you guys. It is Dr. Westman's top 10 fat loss tips, and we'll put a link in the description for you guys to download that link. How are you, Eric?
I'm great. How are you doing, Glenn?
Very good, thank you. So, Eric, one of the first things I always hear you say to folks that want to embark on this type of a lifestyle is that, and especially if they're on medications, is that they will need to be monitored by their doctor because the medications will become too strong.
Yes.
So, is this something that I know that you're pretty emphatic and pretty passionate about? Why is that?
Well, I don't want to hurt anybody, right? I mean, just to say it again, if you're taking medications, you have medical problems, a doctor, an internist, family doctor, or a specialist is following, the medications can become too strong very quickly. I mean, even on the first day. So I have to reduce insulin if someone has pretty good control on the first day. Otherwise, the blood sugars will go too low, and you might have a low blood sugar spell and pass out when you're driving. I mean, so here's the conundrum. The problem is most doctors don't understand how powerful just changing the diet can be, and so they might, unless they have special training, they might give you the false impression of, oh yeah, just go ahead and do that, when they don't know how strong it can be. So the medical world sort of gave up the idea of teaching nutrition in the 1980s, 1990s, and now most doctors come out of medical school and residency without any nutrition training, let alone knowing how powerful a keto diet, meaning cutting out the sugars and starches, can be in terms of improving these medical conditions. So again, if you're taking medicines, you don't really understand what they're for, and you're not medically trained. And yes, I've had nurses and doctors adjust their own medicine on their own, but they're trained in how to do that. So I would urge you to not think that this is unsafe. No, it's therapeutic to cut the sugars and starches out. It's just that the medications are being used to treat the diet that you've been eating and the resulting diabetes or extra weight or arthritis or all the other heartburn things that the diet causes. So and it's been interesting because a lot of programs have come up on the internet, and a lot of people do this without consulting doctors, and you'll hear people have side effects when it bugs me because it's the medicine that's giving the side effect, not the diet. But nobody told the people, you need to be careful if you're on medicine, or the doctors that aren't trained in helping you understand that if you have a low blood sugar on the first day, it's not the diet's fault, it's the medication's fault. And so I get to, in fact, I remember I get to take charge of the medicine and the diet all at the same time. And I remember a diabetic educator, a very nice person, who was mad at me because she knew that people with diabetes had to eat carbohydrates. And I said, what do you mean? And she says, well, I stop low blood sugars by having people eat carbohydrates. And I said, well, what's the low blood sugar from? And she said, well, she didn't know. And I said, low blood sugar is from the medicines. So many people in the diabetes education world are taught to handle and to stop the low blood sugars that happen because of the medication. So I come in as the doctor taking charge of the medication and the diet, and I explained to this person, a diabetes educator who was mad at me, that no, I take people off the medicine as they start the diet so they don't get low blood sugars. But so even someone who is in this field for years, and a respected educator, didn't understand that the blood sugar won't go low unless you're taking diabetes medicines. That's the cause of the low blood sugar. And the teaching that you need to eat 3 meals a day with 2 snacks if you have diabetes is because you're on medicines for the diabetes. So so your blood sugar won't go too low unless you're on those medicines. And of course, most people aren't taught that from the beginning. And I've even had some people who feel like something's wrong when they're not injecting insulin because they've done it for 20 years. But there's no one happier than the person who has a normal blood sugar off insulin just by changing the diet. It's amazing. And that's what we do by using effective lifestyles like the keto diet. It's really amazing. But again, caution if you're on medicine, and I mean, we can get into the nuances of which medicine might be okay and all that. But I just knowing that I don't want to harm you when you change the food, and most doctors don't understand how powerful it can be. It's important to just keep that in mind. Be careful.
So to add to what you've been saying, to give more credibility to what you've been saying, if you actually think about it and logically, people that are type 1 diabetics really understand food very well, because they actually have to accurately account for how much carbs they're having, or even how much protein they're having, to be able to account for that in the amount of insulin that they take. So this is very, very well known. It's not something that's not well known. It's very well known in, for example, type 1 diabetics. Yet it seems that people don't really understand. Like you said, the nurse didn't really understand. Did she seem to understand after you explained it to her?
No.
Still didn't understand. Still thought you were harming people. Wow.
But if you've been doing something for, decades, and you hear just one random doctor talk about that, you need to hear it over and over. And even then, a practitioner in my area, the other doctors don't really come around until we share the same patients. And so I'm a specialist sort of practice within a university setting. So I have a lot of fellow doctors who are internal medicine and family medicine trained in my system, and they send me the patients and I send them back fixed. Then they start going, oh, maybe there is something to it. So, yeah, and you have to remember, we train doctors and other healthcare providers to give medications. I'm afraid our medical system has become a give medicine system without regard to lifestyle, or they give short shrift. They say, oh, well, no one does lifestyle change. And no, actually you can. And, I got into this years ago because 2 of my patients did this on their own. And I thought, wow, they didn't even need a doctor to fix their obesity. So no, you don't expect your doctor to, jump right on board. If it's the first time they've seen it, they'll say, oh, lightning strikes. And then the second time, oh, lightning strikes twice in the same, then the third time, the fourth time, then they start sending all their patients to me. And now, I have a 6-month waiting list in my university practice, which is why we're extending our reach through digital platforms.
Now, I've often heard you say that implementing the ADAPT program is the same as taking a prescription pill.
Right. Well, multiple prescriptions. So the evidence for that is that I take people off medications. There's actually a term for that now called de-prescribing. The term prescribing means you're giving medication. The de-prescribing means you're taking away medication safely. And I've taken people off 10 different medicines. It's hard to imagine. Common? Pardon me?
Is it common to take people off medications?
Yes. And so the typical internal medicine bread and butter patient that is in our clinics in the US, they're on high blood pressure medicine, and they may be on 1 or 2 or 3. That's kind of how things start as you're gaining weight on eating foods that are not healthy. First, the blood pressure, you gain weight and the blood pressure goes up, and then you may have diabetes. So there may be 2 or 3 first pills and then shots. And then now people are on shots and pills for diabetes. In fact, insulin is now being made in even more concentrated forms so that you can inject not only 100 units per ml, but 500 units per ml. And anyway, so you're on now 3 or 4 or 5 medications just for diabetes and high blood pressure. And then now if joint pains start happening, I see people being introduced to medications for pain and arthritis and inflammation. And then, if you've had atherosclerosis or inflammation of the arteries, then you might have developed heart disease. So you're on a beta blocker, and if you have had a stent, you're on an anticoagulant of some sort. And so this is kind of the stereotypical 60-year-old male, most likely in the clinic, where they're overweight, they have heart disease, diabetes, high blood pressure, arthritis, and they're on medicines for all these things.
Now, in your clinic, you see folks on all types of medications. What are the most common medications you see folks taking, which specifically become too strong once you embark on the program? Just give us maybe the top 3 or 4 medications that are worrisome or bothersome that you would worry about if someone was embarking on this program without being monitored. Which are those medications?
So they're all diabetes related, right? So insulin, injectables like Byetta, that one was actually turned into a weight loss medicine called Saxenda, but even blood sugar pills like glipizide and glyburide. And what's interesting now, insulin has been given different names. So you might think it's not insulin anymore when you're still injecting a shot and it's measured in units, it's still insulin. So some people come in and say, well, I'm on Lantus. No, that's still insulin. So, but that's what I really worry about on the first day. If any of these diabetes medicines, although metformin is fine to stay on for a while, but that's really where the concern is on the first day. It's the diabetes medicines.
Now I know that one of the other ones that become one of the other medications becomes too strong is definitely blood pressure medications, because blood pressure typically normalizes once you go on a keto diet.
Yeah, that I like home monitoring of all of these conditions. Everyone's in the routine of measuring blood sugars at home. In my area with these monitors, you can actually measure blood pressure at home. And so I highly encourage even the wrist cuff. It doesn't have to be up on the upper arm, but I don't worry about that on the first day. So that's where yes, I'll introduce the idea you need to be checking the blood pressure at home because you live at home, not at the office, and the blood pressure can come down. That's usually a matter of days to weeks, and maybe even months. So, and maybe even you might never get off the blood pressure medicine. I have some people I've followed for 5-10 years. They're still on blood pressure medicine, but that's because they're older. They're probably their arteries, their pipes, if you will, arterial stiffness leads to that. So, but the diabetes the first day, in a matter of minutes to hours, that gets better. And then blood pressure medicines over time, I typically deprescribe the blood pressure medicine when the numbers start getting into the low normal range or on blood pressure, or even for blood sugar, for that matter. We talk about tapering the medicine with monitoring over time. And I see people sometimes every 2 to 4 weeks. If there's a lot of action going on in terms of the diabetes and the blood pressure, so that's very different than the doctor who says, see you back in 6 months, right? So you want to make sure you're checking in, have access to someone who can help you figure out how to deprescribe the medicines if you don't know what to expect.
Now, speaking about medications and possibly slightly different to what we've been discussing now, medication becoming too strong, there's also certain medications that contain sugar and can interfere with folks achieving their fat loss goals or other types of goals. Now, have you got maybe the top 3 or 4 medications that contain sugar that could interfere with this type of thing?
Well, the prescription medicines tend to be small enough, or even if it was pure sugar, it's a trivial amount. So prescription medicines, the ones I worry about are the steroid medicines that raise the blood sugar. So it's indirectly, it's not the sugar itself. So steroid shots are given for allergies and nasal steroids. The lung steroids don't seem to be an issue because it's a much lower dose. But then steroid shots into the joints. You may have had a hip injection or a knee injection for arthritis pain, and then that raises the blood sugars and stops and raises the insulin and stops the fat burning. But in terms of pills, the only time I've seen that as a problem is in the over-the-counter, like I guess they could be prescription too, but the supplements. Some people come in taking dozens of supplement pills, and they have you look on there, there's 1 gram of sugar per pill, which would be fine if you only had 1 pill. But if you're taking 20 of these different supplements, and including like the Metamucil or Psyllium sorts of supplements for motility, bowel motility, I'll want you to choose something that doesn't have all of those carbs in them, the sugars, because yes, sugar, even the fiber that's called non-absorbable fiber can be absorbed and impact the blood sugar and the ketones. So I suspect these things where other doctors might say, oh, net carbs, don't worry about it. I worry about those things, and because I've seen it influence the metabolism of people. So I do a careful screen for all of the different supplements and vitamins and minerals that people are taking, and explain that now that you're eating real food and you're mainly eating from meat, poultry, fish, and shellfish and eggs, you're getting all of the vitamins and minerals you need in the food that you eat. So you don't have to have all of those extra vitamins and supplements.
Well, thank you for these amazing tips. Have I left anything out that you would like to discuss regarding medications?
You may be surprised at the medicines that are just no longer needed. I mean, this is one of the sleeper ideas that a lot of people don't talk about is just about everyone comes off their heartburn medicine, and it happens in a matter of a week. So it turns out that it's not the spicy food and the fat and that causes heartburn. It's the carbs. And of course, our paper was published over 10 years ago, so nobody knows about it. But there is a book called The Heartburn Cure, and it's a low carb keto book. And that's another medicine that I see most people coming into me taking, because doctors just hand that out like candy, I'm afraid. So yeah, there are all of these other medicines that you no longer will need because the underlying process is caused by the carbs, and then you're limiting them or minimizing them. And so the heartburn medicine's gone.
Excellent, Eric. Thank you so much for all this valuable information that we get every week from you guys. That's all from us today. Don't forget about the bonus. It's Dr. Westman's free top 10 fat loss tips that we will put a link in the description, and you guys are welcome to get that and download that. If you would like to learn more about Adapt Your Life Academy and our upcoming courses, our online courses, you can find us at adaptyourlifeacademy.com. If you enjoyed this video and would like to see future videos, you can find us on our YouTube, Facebook, Instagram, and Twitter accounts under the name Adapt Your Life. Eric, until next week, thank you so much for your time. We look forward to our next topic, which we will cover next week. Thank you so much, Eric.
Thank you, Glenn.
Thank you.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.